for a few people, so I didn't start. But it's 7, so let's not be late. It's my pleasure today to have Jennifer Spicer, but I don't know, but I met on Twitter, and she's, if you haven't seen the little flyer, she's an assistant professor of medicine in the Division of Infectious Diseases at Emory University. She has a very diversified background, so she has studied marine science, microbiology, she went to medical school, completed a master's in public health, and is now doing a master of education. She has been developing abstracts and infographics on COVID-19 in order to help healthcare professionals deal with all the amounts of information that we received during this pandemic. And this topic was particularly interesting because you've all seen how science communication has impacted the research, whether it was because of poor use of social media or deliberate use of it to spread very quickly messages that weren't already supported by data. So yeah, I'm very happy to start this series, and I'm very happy that Jennifer is going to start with this very interesting talk. So as a reminder, don't forget, if you have questions, you can just post them in the chat and I will just read them to Jennifer at the end. So thank you, all of you, for joining and well, we're listening to you, Jennifer.
All right, perfect. So let me share my screen. Okay, so thanks again for inviting me to come and talk today. So I am a physician, and what I primarily do is take care of patients, but I do spend quite a lot of time actually educating both medical students and residents and infectious disease fellows at our institution too. And this has been a very challenging year for everybody, especially for physicians, as we've been kind of battling the COVID pandemic, and especially when there's not a lot of information known and we are really learning at the same time as everybody else. And so that's somewhat what encouraged me to look into this topic and to start developing some educational materials for healthcare professionals. So today what I'm going to talk about are some of the advantages of using social media for scientific communication. I'm going to use the COVID pandemic as a case study with our initiative that we did, but I think this applies more broadly to all scientists. I hope that by the end of this, you could outline a plan for how you could potentially use social media to educate others about scientific topics or even other topics too, and to describe some best practices for developing scientific content for social media to engage others on the platform. And so I know this is going to be recorded, but just to give me an idea of who is here in the talk right now, if you don't mind just answering this poll briefly so that I can get an idea of your experience both with Twitter, but also who is in the audience right now. So I'm going to give you a few minutes to answer that. All right, perfect. So I actually am really glad that there is a variety of people and knowledge about Twitter and not many people who post professional content. And it looks like primarily students in the audience. So I think that honestly, one of the things that I've been really excited about with this initiative has been the ability to actually engage our medical students in this initiative. And I'll say that most of them were not on Twitter or didn't use it much before this. And now I think almost all of the medical students at Emory have joined Twitter, partially because of this initiative, and have found it to be very valuable. We're actually in the midst of surveying them to find out a little bit more about their experience. So I think that, effective communication is really essential to everything that we do as scientists. Our job and our goal is to discover new things and to have an impact on the world through that. But to be honest, that can't happen unless we are good at communicating our results. And that may be communicating them to other scientists. So that may be through journals, or through other summary resources. So for physicians, many of us use something called UpToDate. And that is really a summary resource about different medical conditions that we can just pull up on our smartphone while we're taking care of patients. But I think that we also have an obligation to communicate with the broader community and with either scientists outside of our field or non-scientists. And a lot of that happens through other venues. News and social media are probably the two most common ways that people hear about science in other venues. And this talk is another example of ways that we can communicate things through other venues with the general public. So it is hard to communicate science effectively, especially when you have a diverse audience who may be looking at what you are presenting. So we know that there can be accidental misinterpretation of material, and we've seen a lot of this in the current COVID pandemic. There was recently this article in the New York Times, I think last week, saying, it was quoting a recent study and saying that it provided evidence that medical workers needed to be using N95 masks instead of surgical masks. And to be honest, that's not really what the study said, but this article went and described that as the main finding. So this created a lot of controversy in our community. There were a lot of scientists very outspoken on Twitter about it. And, to be honest, there's still a lot we're learning about this. But I think that this can be some of the danger and accidental misinterpretation that as scientists, we have the ability to impact. But then we also know that there's a lot of purposeful misinformation out there. This has become very prominent with the coronavirus pandemic, but we all know that things like global warming, vaccination, all of those have been areas where there is a lot of purposeful misinformation out there in the broader community. So I think that social media really provides us with a great opportunity to communicate science. It has a large audience. It allows for really quick dissemination. And I think more importantly, it allows us to have a dialogue, both with other scientists, but also with the general public about our findings. So with the COVID-19 pandemic, actually the way most of us found out about this was from social media. There was a physician in Wuhan, China, who warned of all of these patients he was seeing with pneumonia, warned about this on social media, and actually got reprimanded for this. But this is how most of the world ended up finding out about this new outbreak. This has been the way that many of us in the medical field, and I know in other science fields, have been sharing information about coronavirus, especially in the beginning when there wasn't much peer-reviewed literature about this topic. The only way that we were really able to find out about it was word of mouth. And it was important to be able to communicate with others who were in the epicenter of the pandemic. And I remember very clearly back in March, before we had many cases here in the US, we were really following social media and communicating with our colleagues in Italy to help us better prepare for the pandemic here. So we were using Twitter to learn, and I'd say that there's a lot of different social media platforms. Today, I'm really focusing on Twitter because Twitter has a very large, at least health professional community on it. And I know there's a lot of other scientists on it too. I think that Twitter has a lot of potential for science communication in particular, especially among scientists, and has been used that way a lot. So here's an example of a tweet that was on Twitter back in March. And this was when there were a number of coronavirus cases in Seattle, Washington, in the US. And people out there were collating their experience along with the peer-reviewed literature to make summary guidelines for health professionals. And this is how many of us were accessing this information, because there weren't other great published sources out there yet. So you can see on this, there were 407 retweets, meaning that people shared that topic on their own feeds, and 718 likes. This was seen far more than that on social media. And so this is really a pretty broad viewing of this topic. And you can see here, it was a handout that he was sharing. Again, this was a physician who was sharing this information to try to help others who are so busy taking care of patients that they didn't really have time to sit and read a lot of peer-reviewed literature. They needed something quick that they could read when they are there at work trying to take care of a new patient. So again, social media is really important to communicate, but I think that it also has the potential for a lot of misinterpretation and misinformation in sharing all of this. And so it is something that we have to be careful about, and I think is something that we have the opportunity as scientists to really combat. So one example is the sharing of information prior to peer review. This has become very common, especially right now with the pandemic. And this was back when hydroxychloroquine and azithromycin was first being reported as a potential therapy for the for coronavirus 19. And this was a tweet of somebody sharing this information, saying it's irresponsible not to pursue this option aggressively. And this was based on the proliferation of what we call preprints, which are finished manuscripts that can be submitted to servers, but have not undergone scientific peer review, meaning that nobody has looked over it to ensure that this is accurate, to make sure that it is something that we can responsibly report out to and publish. And this is part of what is so important about scientific communication, the scientific literature, is having this gatekeeper and this ability to ensure that we are publishing correct information. So this study on hydroxychloroquine and azithromycin has received a lot of press. This was initially on preprint servers and was actually published in a journal in March. This was an observational study, so it was not a randomized control study, but it reported the results of using hydroxychloroquine and azithromycin. And as a health professional, this was very shocking data because many of our treatments just are not this good. So this showed that for patients who were positive for the coronavirus, that their test became negative within 5 days, all of them who got hydroxychloroquine and azithromycin. This is not something that we see in randomized control trials or really any treatment trials. And so I think that many of us in the medical community were very skeptical initially, and there's been a lot of controversy about this study. It's an observational study, and there have been multiple randomized control trials since this that have shown that this is not an effective treatment. But the problem was this led to the proliferation of this being used worldwide. And so I think that it shows the impact that social media can have on the practice of science, but also the potential pitfalls. So another reason we were all using social media is, to be honest, it was difficult to keep up with the literature. There were more than 1,000 articles published on coronavirus per week. So each of these bars represents per week publications on PubMed, which is our peer-reviewed database that we use as health professionals. But then the smaller bar represents a lot of different preprint servers. So you can see it was a lot of information to wade through. So because of this issue of trying to make sure that we are sharing reliable information, but also wading through all of this data, myself and the infectious disease fellows at our institution wanted to figure out a better way to educate health professionals and share reliable, credible information during the COVID-19 pandemic. So our goal was to curate, summarize, and disseminate recent COVID-19 literature to health professionals in particular. Here is our process. So first, we needed to identify the relevant articles that we felt would be practice changing. And this was done primarily by the ID fellows in our division. So physicians still in training for their to become specialists in infectious diseases. They were really the ones who started this initiative. So Amy Sherman, who is one of our fellows who just graduated yesterday, actually, started this initiative with all of our fellows. And what they did was they monitored new publications, both in PubMed, but they did also look at preprint servers because we really needed to know information as quickly as it came out in the setting of this pandemic where people really needed new information. And the peer review process can take quite a while. So that was part of the reason that they decided to include preprints and not just the published peer-reviewed literature. So each ID fellow was assigned a different area to monitor. So they would look up all new information on that topic each week, and then they would pick a few key articles that they felt provided new important information. So they started publishing this on our website. So this is Emory School of Medicine's website, and this has all of the summaries the ID fellows created. You can see this document to the right here. This was an example of the bullet pointed list that happened for each article. And this was meant to, again, be 10 to 15 high impact articles that were published during that week on the coronavirus. And so this was then shared with all the faculty. And initially it was meant just for our division. But we quickly realized that this was something that was needed really other health professionals within our institution, but also beyond our institution. So that's when the idea came up to create visual abstracts that could be shared on social media. So this was actually done by a team of medical students at our university who were unfortunately displaced from their coursework during this time. Many of them were supposed to be working in the hospitals, but because they were non-essential healthcare professionals and couldn't practice on their own, there was a recommendation from our national society that they should not be taking care of patients with coronavirus at that time. So I think all of us probably understand the power of visuals to communicate. I think that this is probably one of the most visible things that all of us have seen during the coronavirus pandemic. I don't think anybody knew what flatten the curve was unless they had studied epidemiology before this. But now I think that you know, almost anybody you go up and talk to would be able to describe what flatten the curve means. And it's all because of this one visual that was published in multiple different capacities and has really helped people understand this concept. And the reason that visuals are so effective is they harness what's known as the pictorial superiority effect. So we know that our eyes are really the first thing that take in new information. And so, for example, on social media, when you're scrolling through, visuals are going to catch your attention more than words. Now, when you look at visuals, they usually make it easier to interpret and digest if they're done well than text would be. And this really helps to put the visuals into our working memory, which then allows us to store it in our long-term memory, which is the ultimate goal of any type of initiative like this. We wanted health professionals to be able to quickly digest something, look at it, understand it within the span of a couple minutes, go and read the article if they have time, and then store this in their long-term memory so that they knew what to do when they were actually taking care of patients. So this has actually been something really popular in journals. I don't know actually how much it has been done outside of the health professions. I'm sure that it has been. In the health professions journals, this has become very popular and was actually started by Annals of Surgery, was the first journal to officially start creating visual abstracts. They've been shown to increase engagement on social media and to get people to click on the articles and also to remember key points from the articles. They're still relatively recent, so there's not a ton of studies on them, but there are more studies coming out. And I find these very powerful myself. You know, reading an abstract is great, but seeing a visual with text helps me to interpret it better. So here is an example of one of the visual abstracts we created on the remdesivir randomized control trial that came out. So you can see here we have a one-sentence introduction at the top saying what it is. We describe the study population and then the study design. We briefly present the important results. Again, trying to just get the critical information in there. And we felt that it was really important to mention limitations because especially with a lot of the early literature on COVID-19, they were not always the best studies. And it was important if we were citing something to mention the limitations so that people knew how to apply it to their patients. And then we provided a one-sentence summary conclusion and the citation so that people could then go and read more about the article and knew where the data came from. You'll see on here, we also have a date, and we felt that was incredibly important because again, information was going to be changing rapidly, and that would help people realize the date of these visual abstracts and when the data came from. So we also want to make sure that these were reviewed for accuracy. So we were taking article summaries and medical students were then creating the visual abstracts, but we wanted to make sure nothing was missed and all the important information was in there. So we then had the ID fellow or faculty member who had done the article summary review and approve the abstract before we then disseminated it. Again, trying to make sure that we are disseminating high quality information on social media. So I posted the visual abstracts daily with a short summary. The reason I posted them is we were going to start a new account, but the problem was we wanted to get as much visibility and engagement as we could, and getting a new account up and running and getting enough followers is difficult. As a ID faculty member at Emory, I had a fairly large following, and so I knew I could disseminate this to other healthcare professionals because that's primarily who was following me at the time. So you'll see here that we include a bottom line summary of what this is about. We acknowledge the individuals who created the visual abstract. So the students, the fellows, whoever reviewed it. We added hashtags. So we used the hashtag education in the time of COVID to make it very easily searchable. We then had the visual abstract included as an image. And then I tagged other ID health professionals across the country to get higher visibility, because if they are tagged, it's also going to show up in their social media feeds. And so this is a way to help disseminate your communication on social media more effectively. And all of the people I tagged are people who I'm personal colleagues with, and were fine with me tagging them. So our team created, as of today, we have made 139 visual abstracts. We have had 116 medical student creators who have participated in this and 33 faculty and fellow reviewers. And we've actually pulled in some fellows and faculty from Johns Hopkins and from Baylor. The med student effort was led by Caroline Coleman and Tyler Dougherty, who have really been the ones kind of editing all of the abstracts, making sure the visuals are very clean and easy to interpret, and training the medical students on how to create these. And then, as I mentioned earlier, Amy Sherman was the one leading our fellows to ensure that they created the summaries. Our abstracts had a pretty wide reach. I have some Twitter analytic data that I'm not sharing today because it has been submitted to the Twitter data.
Hello?
Hello? Do you mind muting yourself? So the Twitter analytics we have analyzed, and we are going to be presenting them actually at a meeting. We just submitted that abstract. So I'm not presenting all the Twitter analytics, but some of the other data. So I've included a few of our abstracts that had really high viewing, probably because of their topic. So this one was on the immune response and steroids for coronavirus. This was back all the way in March before we had the recent study that is going to be coming out soon. We also did one talking about contamination in the medical environment. And this was one that was really popular and engendered a lot of discussion on social media. And then this was one presented early in April that was talking about the spread of coronavirus from asymptomatic individuals. And this was a really hot topic, still is. And this was one of the first studies that showed that we shared. We've also translated it into other languages. So Spanish is the first language that we've been translating it into. This is the Twitter account and the same tag for the Instagram account that is discussing and submitting these abstracts. It is led by Dr. Lila Watt-Colburn, who is joining the Emory faculty actually now. She was at Baylor previously, and a number of Emory medical students and undergraduate students, including 2 from Guatemala City, who have been leading this as an international effort, and they are now translating these into French and Arabic too. There have been a lot of other initiatives involved with scientific communication of COVID-19, both for patients and health professionals. Virtual journal clubs are pretty popular on Twitter now, and ID Journal Club is one that started for infectious disease professionals. Started sometime last year, but they have been reviewing coronavirus literature almost weekly. And this was the big study back from that has now been retracted. And part of the discussion in this Twitter Journal Club, the reason it was presented is we had a lot of concerns about it actually. And so some of my colleagues who are leading this journal club decided it was important for the ID community to discuss it. We had a lot of other non-infectious disease individuals join too. And a lot of people ended up signing a letter requesting the retraction of this article because of its flaws, and it now has been retracted. There have also been a lot of accounts created focused on more patient education. So here are 2 accounts, again, by some of my colleagues around the United States. And I know there have been a lot of other initiatives in other countries too. And social media has been used a lot to communicate scientific advocacy too. personal protective equipment has been something that has been a problem and continues to be a problem for health professionals. And so #GetMePPE was something shared by many health professionals to raise awareness and communicate this issue with the broader community. So I want to close by just sharing a few best practices from our experience for others to consider when using social media to communicate. I think the first is to really think about who your audience is and tailor the content to the intended audience. So you're obviously going to reach a broad number of people on social media, but I think that you can decide, is your audience primarily experts in your subject matter, health professionals and other scientists like ID Journal Club, or is your goal more to educate the general public? Because what you're going to post is going to be very different on those two, with those two purposes. So for example, on the COVID 101 account, there was a recent article discussing safety and returning to church or other big events and what could be done. That would be very different from something that would be posted on an account for experts in the topic area. Although you're going to tailor your content, I do think it's important to recognize that it's going to be seen beyond your intended audience and to be think about how others may interpret it. So for example, in the beginning of the pandemic, there was a lot of discussion about therapeutics. And in early April, hydroxychloroquine was a really hot topic, but many of us in the infectious disease community were starting to doubt its effectiveness. And so I wanted to teach people why we thought that it may be effective, but I wanted people to understand that this was not something that I was necessarily advocating for. And so for other individuals on here, I wanted to make it clear that we did not have sufficient evidence to say that it was effective. I think if we are posting in a professional manner and from our role as a scientist in the community or some other expert, it's important for us to post reliable, credible information and to provide evidence or citations. So here's an example of our visual abstracts. And as I mentioned, we put both the citation for the article and the reviewers on here. So these are the people who are responsible for the visual abstract so that people can reach out to us. We also provide the raw data. We choose which data is important to communicate the point, and we repurpose it in an easier to understand format than what is in the initial journal article, but we do provide the raw data. And then we always post a link to the original article in the tweet so that people can then go and read the original article. Because again, this isn't meant to be a replacement, but it's meant to introduce people to the article and the concept. Inevitably, there will be mistakes, and I think it's important to acknowledge and correct mistakes that happen. So for example, very early on, this was a visual about doing the nasopharyngeal swabs, and I was not part of reviewing this one, posted it, and didn't really look at the visual much before I posted it, and had one of my colleagues reach out from another institution pointing out that the direction of the swab was inaccurate. And even though the point of this was not to teach people how to do a swab, it was important to show the correct way to do a swab. So we actually reposted this within 24 hours and corrected that mistake. As I mentioned, social media is a great place for dialogue, but I think that we have to do that very responsibly. And it's really tough sometimes to figure out how to respond to controversial comments or sometimes, frankly, adversarial comments. Whenever you're posting about a popular topic, you will inevitably have trolls from and bots from social media who are going to come and comment on the content. And to manage those in a professional manner is really important. So when we first posted back in March, a lot of the potential treatments for coronavirus. This was before we had any evidence for any of these. I had somebody respond about hydroxychloroquine and azithromycin. And, I mentioned, yes, we didn't include that because currently data is lacking, but we do need additional data. So I didn't want to dismiss it because it was something being studied, although the initial data was not very promising for it. And then the individual kept responding and ended up then bringing in some conspiracy theories about coronavirus. And this was a point at which I actually disengaged from responding. I ended up blocking them from reposting on the tweet thread because I did not want them posting inaccurate data. And, just kind of took that completely offline and stopped responding. And then lastly, I think we need to acknowledge limitations in knowledge. And this is both knowledge and science. So again, when I was posting this, recognizing that we just didn't know a lot at that time was really important, instead of trying to claim knowledge that we didn't have yet. And I think it's also important to address and acknowledge limitations in our own knowledge. So I have been posting these visual abstracts to educate. I'm not an expert in all of these areas. And so when I posted this one about public health interventions, I had someone reach out asking questions about what some of these terms meant, which I was able to respond to. But then ask questions about the use of social media to sample populations and use this as a public health measure. And that's honestly not something I'm an expert in. And so I didn't want to answer inappropriately or with insufficient information. So I just pointed out what I knew, that this wasn't my area of expertise, and I've tagged other individuals sometimes in these posts to join the conversation. So in summary, I hope that this has helped you think about the potential for social media for scientific communication. I think it's great because of the large audience on there, but I think it's really important to then think about who you want your audience to be and try to tailor to their needs. Social media is great because of the quick dissemination it allows, but I think it's really important to maintain reliability and credibility on the platform and to really think before posting and to remain professional at all times. And I think that social media is great because the dialogue it allows, but it's also important for us to make sure that we respond by acknowledging limitations in knowledge and are respectful in all of our interactions with others. So that is everything, and I'm happy to take any questions that anybody may have.
Thank you so much, Jennifer. Super interesting, very nice slides. I'm going to start by reading a question from Jordan Ferrier, texting from Cambridge. He's saying, what target audience do you have in mind when creating a visual abstract, professionals or a more general audience?
Yeah, I think that's a great question. I think it depends. For us in this initiative, we actually had professionals in mind. Because visual abstracts in general are a distillation of the article and are meant to be similar to kind of summary text abstracts. So they contain the information in it. We did also create some more general infographics that were meant to be more for a general audience. But I think visual abstracts in general, people think about those as a professional audience rather than a general audience.
So second comment is actually for me. So that tweet you mentioned about the use of hydroxychloroquine very early, that should be used very aggressively. Of course, like this had arisen from preprints, but also I think the issue was also people who had no scientific backgrounds but used their influence to tweet about it, such as Donald Trump, and we saw it in France as well, how like politicians had done science since high school. Advocating for hydroxychloroquine, and you can't really understand why, but then it actually kind of works because everyone is just having it to it. So it's been one of the major issues as well.
Yeah, And I'll say that, you know, I think that's been one of the challenges when you are communicating on social media in a topic that becomes political, as a lot of the coronavirus topics have. So things like universal masking have been turned into something political. Hydroxychloroquine was turned into something political. And I think that I was very careful to not mix my personal opinions about politics and the way people were using their platforms with the data that we were providing. So I actually did not ever comment about my personal feelings and opinions about Donald Trump and some of the other individuals who were commenting on this, because I, again, didn't want people to see my communication as political. I wanted them to see it as scientific fact. So I was very careful in that, but that did make things much more challenging.
Yeah, I think the whole communication around this has been very challenging for everyone. So we've seen in France that a lot of researchers were actually doing their communication on YouTube before having any kind of data. And then you have like non-scientists harassing you because I know this and this and this just because they've been spending too much time on YouTube. So yeah, it had been a bit difficult. And that study that you mentioned from Marseille, that was actually stated as an observational study. It's kind of an interventional study that is kind of like makes to be observational because it was not done on previous data. They actually recruited people and gave them the drug and then say that it was just observational. So this is part of the whole mess that we have currently in France because of this. Right. Okay. So it was just that for me, there was only that question from Jordan that is actually saying thank you. I don't know if you've seen it from the chat.
Yes, thank you. I pulled it up.
Okay, well, thank you so much, Jennifer. Thank you for being the first one. Thank you for the great talk. And yeah, I guess now everyone has your Twitter handle, so you can all follow Jennifer for more very nice infographics.
Yes, and feel free to, if you want, you can direct message me on Twitter if you have questions or anything that comes up after this. I become really interested and passionate about this subject and happy to help anybody who may have questions.
Thank you so much. And others, I'll see you next Sunday, I guess, if you jump. Thank you again, Jennifer.
All right, no problem. Thanks. Bye.